Good evening. Thank you so much for joining us tonight for today's New Voices for Spina Bifida presentation, Promoting Independence, Bladder and Bowel Care for Children. We are so pleased to have Lisa Boschman and Catherine Fernandez, both clinical specialists with WellSpect. We're so excited that they're going to be sharing their expertise with us this evening. My name is Juanita Panliner, and I work for the Spina Bifida Association. I'm the National Resource Center Manager. And I wanted to mention just a couple of things before we get started. You will remain muted for the rest of the session. However, you will have the opportunity to ask questions at any time using the Q&A feature or the chat feature with Zoom. And if you registered for this event, which you probably did because that's why you're watching us, you will receive a link to the recording of the session a couple of days after today. So you'll have the recording in your email inbox pretty soon. And closed captioning is enabled. And just before we get started and I turn it over to Catherine and Lisa, I just wanted to remind you that we're getting to be closer to walk and roll season. And so here are the dates for the upcoming walk and roll events. If you don't see one in your area, you can always try to do a walk and roll your way. And you can learn more at the website on the bottom of the page, walkandrollforsb.org. So with that, I just want to turn it over then to Catherine and Lisa. And Catherine, thank you so much.
Thanks so much, Juanita. We're excited to be here tonight and talk to you guys more about promoting independence for bladder and bowel care. This is a really important topic, and so we're excited to talk more about that. So my name's Catherine. I'm one of the nurses here with WellSpect, and Lisa will talk more about our clinical team here in just a second. WellSpect is the manufacturer of low-frit catheters and Navina for bowel irrigation. I myself cover the West region of the United States, but we all work together, our team of nurses, to support any user of our products, any healthcare providers as well. I did PICU nursing, a pediatric ICU nursing for about 10 years and have now been with WellSpect for almost 6 years to support our patients and providers of our products. So I'll pass it over to Lisa.
Thanks, Catherine. Perfect. So this is our WellSpect US clinical team. As Catherine mentioned, we provide WellSpect products, clinical support to our WellSpect product users, as well as to clinicians who are teaching with the WellSpect product. And just to tell you a little bit about myself, my nursing background is in urology. I've been with WellSpect now for over 10 years, and I am the Northeast Clinical Specialist Manager. So we can move on to the next slide. Perfect. So let's get started with why bladder and bowel care is so important to children with spina bifida. Most children with spina bifida have both neurogenic bladder and bowel. With neurogenic bowel, there is often a slow colonic transit time and altered rectal and sphincter tone. This causes constipation in about 85% and fecal incontinence in about 70%. So a neurogenic bladder and bowel can have an impact on children's health and reduce the quality of life in both the child and family. So it's really important to establish a bladder and bowel program with your child's clinical team. We can move to the next slide. Now I'll review the interactions between bladder and bowel. First, there are neurologic interactions. So when the nervous system is working properly, the nerves communicate from the brain through the spinal cord to the bladder and the bowel. When there is an interruption in the spinal cord, there's an interruption in the communication, and this interruption can be from a spina bifida lesion, it can be from a spinal cord injury, but that causes an interruption in the communication in the neural pathway. And this causes neurogenic bladder and bowel dysfunction. So in addition, there are mechanical interactions as well, because the organs, the bladder and the bowel, are neighbors. So when the rectum may be full of stool, that could be compressing on the bladder, which compresses the bladder. It may cause symptoms such as overactive bladder symptoms, may cause difficulty with urination, urinary incontinence. And when you have a full rectum and a full bladder, there is also a risk of fecal and urinary incontinence. We can move to the next slide. So let's talk a little bit about bowel management. What is TIE, or transanal irrigation? So transanal irrigation is a minimally invasive treatment for bowel dysfunction. You use either a rectal cone catheter or a catheter that has a balloon, and that catheter is inserted into the rectum, and lukewarm water is introduced into the rectum. The water goes up the descending part of the colon, and it stimulates the bowel movements to help clear the stool out. So transanal irrigation promotes a regular bowel routine and helps prevent constipation, as well as fecal incontinence. After TIE treatment, transanal irrigation, the stool doesn't reach the rectum again for an average of 2 days. And transanal irrigation is a very well-tolerated, minimally invasive therapy and has very few side effects. This therapy establishes predictable bowel routine and restores a sense of control, dignity, and freedom. The goal is to get the transanal irrigation treatment down to under an hour. So most people will start with doing daily irrigations, and then some kids will transition to maybe 5 times per week, but it's highly individualized. So it depends on the kiddo. So some people have slower transits and some have faster transits. So everybody's need is a little bit different. So we really work to individualize the parameters. When less invasive bowel management treatments like transanal irrigation aren't effective, a child may require a surgical intervention, such as an appendicostomy or a MACE. So an appendicostomy is a surgery to create a passage between the abdomen and the intestine. So the surgery involves stitching the appendix which is located at the end of the large intestine, to the abdomen. So it's creating a channel. This may also be called a Malone procedure. So a gravity-fed enema is used with a MACE procedure. We can move on to the next slide. Intermittent catheterization is the gold standard to bladder management. A small lubricated tube is passed through the urethra or a catheterizable stoma to empty the bladder. Intermittent catheterization frequency varies, but most people with neurogenic bladders typically catheterize between 4 and 6 times a day. It's very important to choose a catheter that stays lubricated and is smooth on insertion and withdrawal. This will help decrease the risk of urinary tract infections and trauma related to intermittent catheterization. Next slide, please. Okay, so now let's review the importance of bowel and bladder care. So transanal irrigation has been shown to reduce fecal incontinence, which is fecal leakage. It improves constipation symptoms. It increases the general satisfaction and quality of life because it's providing the child control and predictability. It also improves intestinal flora. Clinical studies have proven this, and which reduces the risk of urinary tract infections. Transanal irrigation also improves urodynamic parameters. So these include normalizing bladder capacity, normalizing bladder pressures. And then we'll look over to the right on the catheterization importance. So, and this is for bladder management. So the goal is to maintain normal kidney functioning. So for people who have neurogenic bladders, the main concern is the kidneys. So we don't want the bladder to become overdistended and have high pressures where the urine can backflow to the kidneys and cause hydronephrosis and put the kidneys at risk. Many people with spina bifida may have hydronephrosis that can lead to upper urinary tract damage if it's not addressed. Intermittent catheterization helps achieve urinary continence and independence. It also reduces the risk of urinary tract infections and the need for antibiotics. This slide illustrates some of the transanal irrigation systems. In the upper left-hand corner, we have the WellSpec Navina Smart system. This is an electronic transanal irrigation system which pumps the water in, it inflates the balloon, deflates the balloon, and it also syncs to an app on a smartphone, either Apple or Android. So it allows the patient or the caregiver to keep a bowel diary to assess their progress with their transanal irrigation. And then over to the right, we have the Navina Classic, which is WellSpec manual system. It's intuitive and color-coded. It has two pumps, one pump for water. The other pump is for the rectal catheter balloon. With the Navina systems, there are 3 catheter options. There is a cone catheter, as well as a small or pediatric catheter and a regular size adult catheter. If you look down to the bottom left-hand corner, there is a picture of the MTG Aqua Flush. This is another system which there is a bag. It is a pressurized system. There is a pump. The only catheter option is the cone, that green cone that you see there. And then over on the right, we have Peristine. So Peristine is the Coloplast transanal irrigation system. And to my knowledge, I believe that they only have the rectal catheter in the US at this time. But the Peristine system is another manual system that has one pump and a dial that controls the water and the balloon as well. We can move on to the next slide. Okay, on this slide, we have some hydrophilic catheter options, and there are many options out there. It's very important for you to work with your healthcare provider to determine what option is best for your child. And sometimes it depends on if your child is at home or if they're at school. The type of catheter that they're using may change. So in the upper left-hand corner, we have the Low-Fric L by WellSpec. The Low-Fric L has the optional handle. It is a ready-to-use catheter. It provides the angle that makes catheterization easier for women. In the middle, we have the Low-Fric Origo by WellSpec. It comes in 2 lengths and in a wide range of French sizes with an insertion grip. The Low-Fric Sense catheter is another WellSpec female length catheter. On the bottom, we have the Coloplast catheters to the left, and in the middle, the Coloplast SpeediCath, and then we have the Coloplast SpeediCath set. And then to the far right, we have the Hollister Vapro Plus. So some intermittent catheters have a bag attached, and then some are just straight catheters where you would be sitting on a toilet to empty your bladder, or you could use an optional leg bag or a urine collection bag on the straight catheter. So you have that option. The longer catheters, I just want to make a note that the longer catheters do come in straight and today. Okay, now we can move on to the next slide and I'll pass it over to Catherine.
Thanks so much, Lisa. So I'll start talking about some unique challenges in children with spina bifida. Each child with spina bifida is different, as we all know. It can be a range of, depending on the severity of the spina bifida, and it really presents differently in each child. So we always take note of this and, really dig in a little bit deeper into the specific child and the family, and we'll talk a little bit about that model here in a minute. But some common challenges is that there may be cognitive delays versus peers. So we'll take this into account when working towards that independence, especially with executive dysfunction. So a lot of kids with spina bifida do really great with routine, but can really struggle if that routine is broken up or there are changes in that routine. So just really working to stick in a routine. If you do, catheterization every 4 hours, your bowel routine is every other night at 6 p.m. after dinner. So just really working with routines, and also having a routine with that bladder and bowel regimen as well. They can really struggle as well with shifting or dividing attention. So I definitely recommend, as you're working towards independence and having them be more involved in their bladder and bowel routine, that trying to really dedicate that time to bladder and bowel care and reducing as many outside distractions as possible. We definitely realize this isn't always possible. There's multiple kids, things come up and your schedule may change, but just doing the best you can to have a routine and to stick to that routine and be focused on the task at hand. For instance, you can do phone timers. So when the phone timer goes off, we know that it's time to do our bladder and bowel routine. You can schedule on a lot of phones or tablets, things like that, do not disturb time. So especially if it's an older kid, when that do not disturb time comes on, there's no, Facebook Messenger messages coming through, there's no text messages, and it really helps keep them on task. I know some phones and tablets as well also have like a focus mode. So that focus mode comes on and it automatically disables specific apps and things like that, to just help make it a little bit easier as well. Instead of, 5 more minutes on the tablet, that when that timer goes on, it's time to do bladder and bowel care. A lot of these kids also do best when information is memorized, but this can be difficult if there's not comprehension of the information. So I really am an advocate of promoting the why we're doing this. So instead of just, you have to catheterize every 4 hours, you have to do this bowel routine, here's the why and kind of here's the bigger picture. If we're not catheterizing regularly or you're not following all the steps, you increase that risk of urinary tract infections. And when you get a urinary tract infection, that can lead to a doctor's visit or missing your soccer game. And kind of giving them that why behind it so they can understand the importance of that bladder and bowel routine. And then just doing that memorization. So just rote memorization, writing it down. You can even do like flashcards, and they can like put the flashcards in order, so that they know this is step 1, step 2, step 3, and that this is the routine. We also have to take into account varied levels of mobility. Some kids may be able to sit and stand off the toilet independently. Some may be in a wheelchair. And so we have to take into account transferring from the wheelchair to the toilet and different mobility limitations, especially as they age and get bigger. And there are lots of different adaptive equipment out there. There's adaptive clothing. I know like even Target had a line recently with some adaptive clothing with like pants and shirts and things like that to make it easier for them to get pants on and off independently. So as they're aging, I definitely recommend if it's open to you to have like an occupational therapy consult. An occupational therapist can do a great job at really taking a look at what they're physically able to do, and then offering adaptations for their specific mobility, whether it be that adaptive clothing, whether it be a raised toilet seat, or specific things for bladder and bowel care that will help with their specific mobility. Also looking at the specific product used. For example, with our low fric catheters, we really worked to make it open to a wide range of mobility limitations. Like Lisa was talking about that low fric L, it has that handle to give different grip options. If it's harder for a girl to lean over as she's learning to catheterize, it adds that extra reach. And same thing with our Navina for bowel irrigation as well. We know it can be difficult once they're on the toilet, that if things are falling on the ground, they're reaching off of the toilet to grab whatever fell. So for instance, we have like lanyards and thigh straps and things like that for our Navina system to help keep it all within arm's reach and on their body. We have grip rings for our transanal irrigation rectal catheters. We have grippers we can send out for free for our catheters. Our rectal catheters and our low fric catheters, a lot of those products have like stickers on the back, so they can stick it against the bathroom wall and have everything within arm's reach. So really kind of looking at that product as well and see what's going to work best. Also taking into account latex allergies. All of our low fric products and Navina are latex free, but just looking at anytime they have a hospital admission or a doctor's visit, looking at the equipment used for that latex allergy. You can go to the next slide, please. Yep. And so some specific methods that can be really helpful, again, is that routine. So just doing whatever works best for your family to stick to that routine. If you can even like write out a schedule and have a big schedule on the wall or the bathroom wall, or in their bedroom, so you can kind of see like this is the schedule for the day, and they can visualize that and just helps them to stick with that routine. And again, it can help a lot with some of that. Well, I want another hour here, another hour there. It's like, this is the routine. Here's what we stick with. At the same time, also giving choice when possible. If you can say, well, we have to do our bowel routine tonight. Do you want to finish watching this now and do the bowel routine, or do the bowel routine and then finish? If you can have a little bit of leeway as much as possible, just so they feel like they have some agency over their routine as well. And again, those concrete explanations. A lot of kids with spina bifida don't do really great with kind of vague explanations or with vague descriptions of things. So having concrete XYZ explanations can be really helpful. Again, those structured visual checklist. You can even have like a marker board with all the different steps for the catheterization or for the bowel routine that you can check off each time. And so it helps keep them, again, in that routine and see that they're visually checking off each step as they go through that bladder and bowel routine. Star or reward charge, these can work really great as well, just as a little bit of external incentive. It doesn't have to be anything big. It can be, a dollar or a toy from the Dollar Tree every week when they do hit certain milestones, or maybe they do get 5 extra minutes on that tablet time. Whatever works and incentivizes for that specific child, and that can really vary from kid to kid. Punishment should not be related to bladder and bowel care as much as possible, though, so that it doesn't create that negative, that negative relationship in their mind. There's some vibrating watches or cell phone alarms if older kids have cell phones, and that can help prompt them that their watch is vibrating. I know it's time for bladder care. For older kids that are working more towards being independent with, say, scheduling their doctor's appointments, ordering their supplies for bladder and bowel, calendar alerts. So when that calendar alert goes off, you can set a recurring weekly, monthly, whatever alert. That when that calendar alert goes off, they know they need to check in on their supplies and reorder supplies. Or say you have like 5 boxes of catheters in your closet, putting like a red sheet of paper on that last box of catheters. So when they see that red sheet of paper, that should be a signal to them, I need to look and order more catheters. For kids that are in school, teacher-led cues can be helpful if needed. Kids don't want to be called out and say, hey, don't forget to go to the bathroom. So if there can be little subtle teacher cues, if it can be, a certain item. I heard at one of the Spina Bifida conference, actually, they talked about one kid their teacher would put like a certain item on their desk. And when that item was on the desk, it was a cue for the child to get up and go and work to catheterize themselves. So whatever works, again, for those external cues that aren't obvious to call them out in front of other peers. Flashcards can work really well to just put like a specific step for each step of the catheterization or bowel routine on that. You can kind of mix them up and then have them put those steps in order as they're learning that memorization and learning the steps. So this is a model I actually heard about at a recent Spina Bifida clinical conference for healthcare providers. And so this is an occupational therapy model that I thought was great. And it's a lot of the things that we're probably taking into account anyways, but it really gives us a great framework to thinking about this to promote independence. And it's great to look at the whole child and family. And I'll talk a little bit more in the next slide and break it down, but really looking at the person, the environment, and the occupation. All of these things are so closely related that we really have to look at all three when finding what product, what routine is going to work best for this child and family. So for person, this is just talking about the individual themselves. We have to look at their past experiences. Some kids may have had a lot of medical trauma in the past. Say maybe they had an ER visit or a hospital stay where there was a really traumatic catheterization. We have to take that into account when they're working to be independent and really kind of working through that. And it might be a lot slower process to independence than some kid that has never had that same experience. Personality of the child. Every child, as everybody's aware, it can be vastly different within the same family. So what works for Bobby may not work for Jane. So really in taking into account the personality of the child and looking what motivates them individually as well. Looking at their specific executive functioning and their understanding of body. Do they understand how the body works, their bladder and bowel system, and their full understanding of anatomy and a little bit of, the physiology on their age appropriate level. Looking at the environment that they'll be doing their bladder and bowel care in. School versus home, those can be vastly different environments. So making accommodations for both of those. Individual bathroom setup. This can really vary as well because one person may be able to pull their wheelchair right in front of the toilet, transfer that way. And if somebody else has a really small bathroom or no grab bars, things like that, that could be not an option for somebody else. Also looking at multifamily homes, if kids are switching between mom and dad's house or they go to stay at grandma's house, a couple weeks out of the year, taking that into account as well, that there's extra supplies in different places and multiple caregivers. Are they able to follow routine schedule at home? Again, like we talked about, routine is ideal, but we realize that this is not always possible. Maybe multiple other siblings have sports events on Wednesday nights, and Wednesday nights, it's just going to be a different schedule. Or mom and dad travel for work occasionally, and there's going to be certain days that the schedule is not the same. So really looking and trying as much as possible to stay with that routine, but having some flexibility as needed, because as we all know, things come up in life and we can't, the routine can't always be followed to a T. And also looking at cultural differences. Talking about bladder and bowel care, how we talk about our body, these can vary greatly between cultures. So taking that into account as well for the specific child and family. And then the occupation, that's the task they're actually doing. So that bladder and that bowel care. So how often are they doing their bladder and bowel care? A lot of kids will stick with daily usage for transanal irrigation. Some kids will wean to every other day usage. How frequently are they catheterizing? What product are they using? Like we talked about, there's a lot of different products out in the market. Is it a no-touch catheter? Is it a hydrophilic? Does it have that attached bag onto it? And what successful methods have worked for them? Maybe you tried a star chart and that didn't work great, but the checklist works really great and that flashcard works really great. And then that clothing, that adaptive clothing, that can be a huge part for them to be independent. And different positions. We have a lot of different positions. We've done some webinars on this in the past about like different positions that work for girls and work for boys, but really just kind of experimenting and see what position and what combination of these factors works best for that individual child. So some developmental age guidelines is I always recommend just start involving the child as early as possible. Even when they're a toddler and in that preschool age, letting them go and get the catheter out of the box. Washing their hands, even if they're not going to touch the catheters, having them wash their hands, talking through those simple and concrete explanations and just involving them as much as possible. Again, with those appropriate choices. Do you want to take off your pants or do you want me to today? So letting them have a little bit of that say in it as well. Begin teaching body parts so they're aware of the body parts. And also with that disclaimer of we're dealing with sensitive body area. So saying, you know, here's what we're doing. These are the appropriate people that should be touching this area and helping you with this, but having that conversation as well when they're younger. And also moving toileting care to the toilet as early as possible. So if you can do your bowel routine on the toilet, your bladder routine on the toilet. So at that age when their peers would be moving to the toilet, working to move, even if they're still using a catheter with a bag, things like that, if you can move that to the toilet at the time that their peers are as well. So then toilet time just becomes around the toilet. With school age, encouraging open communication with caregivers and providers, talking with them before they have an upcoming doctor's appointment and have them start to think, are there any questions you have about your current care? And if they have questions, to write those down. If they're expressing concerns, if they can keep a list of that and give them the opportunity to start verbalizing, even within that school age, these questions and concerns to their providers. Medical play with dolls. A lot of hospitals have child life specialists, and their role is to help, to really help break down medical care into child-friendly terms and to make it more approachable as well. So if your hospital has child life specialists available and they can come to outpatient, I know that can really vary from facility to facility, but that can be a great option to make it a little bit of a safer play, and they can see what everything looks like and kind of walk through the different steps with a doll versus on their body. Those checklists and charts, and really start assist in gathering those supplies as well. And then in that teen year, that increase for privacy, it can be a really hard balance when they have that need for privacy, but they still need that parental oversight. And that can sometimes be just a really slow process of just, you know, slowly backing away on some of that oversight. And there may be some mistakes that occur, but being there to help catch them with those mistakes. I know that can be a really hard transition though. And again, with some facilities, they do have transitional staff as well that they can assist with that transition from that pediatric care to that adult independent care. Knowing too that during these teen years, they may rebel medically. So they may not want to catheterize at social events or do their bowel routine. And this can be really hard because we'd all love to give these kids, you know, a day or a week where they don't have to catheterize and have to do these medical cares and just, you know, be a kid. But unfortunately, that's not possible. They're going to have to catheterize and do that bowel routine. So kind of just monitoring for that, knowing that can be normal. And again, really talking about that why and what these long-term consequences can be from deviating significantly from that bladder and bowel routine. Having more detailed explanations of medical rationales and the consequences, and getting just more in depth as they age. Giving privacy at medical visits. So if you want to step out of the room for a little bit, or even let them have that that visit independently, if they've you know, slowly been weaning towards that, so they can have some of that one-on-one time with their provider. Letting them make phone calls to order their supplies, or being there with them as they call and set up an appointment for urology or whatever specialty they need. And then that increased involvement, with ordering supplies and medical appointments. And I think with this too, again, it can really just vary from kid to kid, but looking at that overall, what is our long-term goal here? Our long-term goal is really to preserve kidney function with catheterizing, to have continence, to be able to bladder care with decreased risk of UTIs, and bowel care with decreased constipation, and that independence. So, some kids can jump like right into full bladder and bowel care. Other kids may need kind of a stepwise to that. But I think really just keeping our eyes on that goal of keeping that bladder bowel healthy and that overall independence, and how do all these factors come together to get us to that ultimate goal. Also looking at settings outside of the home. So working with school administration and the school nurse to have a concrete plan, and ideally keeping them updated. So if a kid is working towards being independent, just having that routine and clear expectations and clear communication of, right now they are catheterizing independently, or they still need help with steps A, B, and C, but they can do these other steps on their own. And also other settings, really just making sure there's multiple caregivers trained. It can be a lot of a mental and physical load if only mom is doing this every single night. So making sure that there's multiple caregivers trained, and also that these steps are written out. So for some reason, say your two main caregivers can't do it for a few days, that somebody else can at least read through the steps and kind of know where you're at a little bit. And also having those plans for summer camp, sick days, sleepovers, things that fall outside of the normal routine. How are they going to adapt to that, and having that written plan that you can pass on to multiple caregivers. There's also tons of resources out there, so please don't feel like you're ever alone in this. There's some great Facebook support groups for bladder and bowel care, and I think it's Spina Bifida, bowel care for Spina Bifida. I forget the exact name, but I know there's a huge pool of families in there that can be a great resource to kind of bounce ideas off of each other. And see what works for other people, and just, try different things with your specific family. Reaching out to the manufacturer's clinical teen education websites. Here specifically with WellSpect, we do have, oh, thank you, Juanita. Yes, that one. It's a great resource from what I've heard. It's a great resource. So here at WellSpect, we have for our bladder and our bowel care, we have like kids comic books that kind of breaks it down and shows the anatomy on a kid-friendly level. We have a Navina app called Flush Hero that kind of walks through what transanal irrigation is. And we also have extensive resources for families as well that talks about how Spina Bifida affects the bladder and bowel, like how to choose a catheter, how to reduce urinary tract infections. And like Lisa said as well, we have a team of 5 nurses that we're happy to chat with you guys and troubleshoot too. Spina Bifida events, like Juanita mentioned, are great to get to see other families and just have some of that community as well, and chat with other people that are dealing with the same bladder and bowel care. And then also talking with your clinic staff, and if it's available to you with your insurance or with your hospital, those OT and PT consults can be great for them to really look at your specific child, see them do, their bladder and bowel routine, and then make suggestions based on that for adaptive needs, or to give you tips of like different things they could try. Yeah, and I'll pass it over to you, Lisa, to wrap us up here.
Okay, great. So this concludes our talk on promoting independence, bladder and bowel care for children. We'd like to give a special thank you to the Spina Bifida Association for giving us the opportunity to provide education on bladder and bowel care. And we want to also thank the audience for attending. So now we'll open the floor up to questions and comments.
Thank you so much, Lisa. Thank you so much, Catherine. And we do have some questions. I feel like I think like one of you is already answering some of them, so thank you so much. But one of the questions that I see is there a solution for Peristeen that you know of? My daughter has been on it for years with just water and has not worked to keep her clean ever.
Yeah.
Do you want to take that one, Catherine?
Sure. So I can't speak for Peristeen specifically. I'm not sure their manufacturer guidelines. At WellSpect for Navina, our manufacturer guidelines are for water or saline is what it's recommended for use, and that's what we're approved for. However, I will say we do have a lot of families that at provider's discretion, if the provider directs them to, they've added glycerin or Castile soap or other irritants to it to help provide a little bit. It can irritate the bowel a little bit to help provide more of a stimulus to the bowel. We haven't seen any issues with that. We always recommend to rinse through with warm, clean water afterwards so it doesn't clog any of that. But that's definitely something you can talk to your provider about, and they would direct you on if they wanted you to start that and which solution and what amounts of it.
And then I also wanted to add, sometimes if you're not achieving the desired results, you can also reach out to your provider to share, what's going on, but it may be that you need to increase your water volume or possibly change the time that you're doing your irrigation. So we typically recommend doing irrigations 20 to 30 minutes after having a meal or a snack, and making sure that kids are staying well hydrated, because if kids aren't drinking enough water, the colon can actually absorb some of that water that we're using for the irrigation, and the irrigation may not be as effective. So you wouldn't want to change the water volume without speaking to your provider, of course, but just to give you a couple of ideas, it may just require some troubleshooting. We have some other tips, such as doing like an abdominal massage to help provoke that bowel contraction, to have a bowel movement. So just in the shape of the colon, kind of starting at the lower right-hand corner and massaging up, over, and across to help stimulate that bowel movement.
I'll just say too, if you don't have it already, and I'll try to put it in the chat, the lifespan bowel management protocol has a diagram, I believe, of the massage that you were just talking about, Lisa. So it does give like a nice little handy, how to do that.
Perfect.
And we have another question here. How to teach child to insert anal catheter with TIA system? Any ideas?
I could make a couple suggestions. So there are different ways to insert the catheter. If your child is able to stand, that is one option. You can insert the catheter in that position. The catheter can also be inserted by either the front going in between the legs. So you would have your child do like a pelvic tilt, and then the catheter could be inserted by the front, or you could reach around the back and insert the catheter that way. Are there any other tips that you have, Catherine?
Yeah, I think it also depends on how old they are and their mobility level. If they have a hard time, especially if they're older and it's harder to move around some. If they have, like, I've seen the shower chairs that almost like double as the toilet chairs. So it's open in the front and then open underneath. And some people move that over the toilet. So then there's that gap between the toilet, that the shower toilet chair, and the actual toilet, so you can fit your hand under to do that. But yeah, it can just really vary on the age of the child, on their mobility as well. But yeah, just what Lisa was saying, those are some of the tips that I usually use as well. I always caution for girls, if they are inserting from the front, just to be really cautious. They're inserting into the rectum, especially if there's some decreased sensation. It can be easier than you think to actually accidentally insert into the vagina. So just making sure they are inserting into the rectum for girls.
And is there a catheter that works best for toilet cathing?
Yeah, this can oh, go ahead, Lisa.
Go ahead. Oh, okay. So it depends on the sex of the child. So for females, we generally recommend, if she's sitting on the toilet to catheterize, using a shorter catheter makes cathing much easier. And for boys, it depends on the age of the child. So for example, WellSpect has a catheter that is 12 inches long. So if they're able to stand at the toilet and it's a younger child, the 12-inch option is available. And then WellSpect also has the low fric or Rego in 16 inches, but there are other catheters as well.
Thank you. And actually, I have a question for you. What guidance might you give to parents of children in daycare who are having difficulty with the daycare staff either not accepting the child, or not accepting the child because of having because of their bowel and bladder needs, because of having to cath, etc. I don't know if it varies from state to state. Sometimes I get questions from parents who are having a challenge, particularly on daycare.
Yeah, I think like you're saying, it can really vary from state to state if they have specific regulations, or maybe even daycare to daycare. There may be certain daycares that aren't allowed to do certain medical procedures with the typical daycare staff. I know it's a lot easier when they get into, if they're in a public school and they have a school nurse, that should be available to them. I'm honestly not sure about the regulations about providing that medical care at the daycare level. I would say if there's staff that are willing to do that, and from like a legal standpoint, the staff are allowed to do that, but the staff are just really nervous. Reaching out to either your office or you manufacturer, if you manufacture like WellSpect has nurses, we're always happy to hop on a Zoom call with other caregivers and kind of talk them through some of that, some of those steps of catheterization to feel more comfortable with that. You can also reach out to your doctor's office and see if they have resources, if there's somebody that's able to do that, but that just needs some support and teaching.
Okay, well, thank you very much. And then there's actually another question. What is the best way to convince doctors of the need for a bowel regime? We have been doing daily Dulcolax suppositories, and I would love a predictable routine.
So it really depends on the provider. So if you are working with a pediatric urologist, some pediatric urologists don't do the bowel management. It may be more of a pediatric GI, but it might just be a matter of educating the clinician on the therapy. And we would be happy to do that if you'd like to reach out to us. We'd be happy to share that information on transanal irrigation to see if that might be an option for your child.
And I think too, sometimes it can, providers may have an understanding that it can be a lot of paperwork or really big hassle for kind of that insurance side as well. And, sometimes they may have limited bandwidth and limited staff, that it could be really hard. And we work really hard at WellSpect that, as soon as we get that prescription, we do everything that we can with that insurance side. We can even assist with training. So we can help take away a lot of that admin side if that's a concern as well.
All right, well, thank you again very much. I don't see any more questions right now. Thank you so much for your time and for your expertise.
I think we have one more that popped up.
Oh, you do? We do have one more.
You just did. Do you want me to read it or?
Yes, go for it.
Okay. Do you have any tips for getting girls to cath on the toilet independently? We've been occasionally successful on the side of the tub and need to make the transition to doing it on the toilet when ready. Yeah, so we do have a lot of tips for girls. I think really walking through their anatomy. I usually recommend in the beginning using mirrors so they can look at their anatomy, becoming familiar with it. But as much as possible, catheterizing by feel is going to make life a lot easier and make that catheterization process much quicker. So that low Frick L that we have, it goes as low as 10 French, and that can really help just with that anatomy. It can work, be a lot easier to catheterize by feel using that. We do have some mirrors that we can always send out. We have like a leg mirror that has a mirror in between the legs, and then a mirror that actually has a little piece. And so the mirror sits independently between like the toilet seat and toilet bowl. But I really do try to teach as much as possible catheterizing by feel. And so what we'll recommend is with clean washed hands is that they can take their index finger and feel for that vaginal opening and put their index finger over that vaginal opening. They can even take their thumb if they would like as well and put it around the clitoris, and that then the urethra is between those 2 points. If you touch the urethra, you can just do another cleanse with that, a gentle wipe with a baby wipe. But having that finger over the vaginal opening can be a great landmark, as the urethra is just above that and can help block the urethra or the catheter from going into the urethra. I've seen girls as well that if they're in a wheelchair, they'll transfer to the toilet and bring the wheelchair directly in front of the toilet, and then put their heels in the wheelchair and allow their legs to fall out kind of like a frog. And so their feet are in the wheelchair seat. And so that props up the pelvis a little bit and also opens up that area to have better access to catheterize independently. Lisa, anything as well?
No, I think you really hit it all, Catherine. That was great. We have one more question. So what are some reasons you would suggest moving from transanal irrigation to a MACE or similar? I'm getting pressure from my medical team to move to a MACE or mini MACE for my daughter. They're not familiar with Peristeen and do not seem interested or able to support or troubleshoot what we do with Peristeen. The default seems to be surgery. Any ideas? I would just encourage you to advocate for what you feel, you want for your child. And it seems like, this might be a learning opportunity for the clinic. Maybe the providers aren't familiar or using transanal irrigation, but I would encourage you to reach out to a manufacturer like WellSpect. We'd be happy to assist you in providing education. And like Catherine said earlier, we also do a lot of the patient and caregiver training. So we take that responsibility, off of the provider's plates because we know that they're busy in clinic seeing patients. So we'd be happy to help you with that.
There was another question actually going back to the mirrors. Do you have any idea where we could find these mirrors?
Yeah, we can send those out to you guys. Yep. So you can just contact us and we can send the mirrors out. We usually start with the little round mirror and that works for a lot of people. And it's a lot easier and more compact. And then if they're still really struggling, we can work with that like mirror. But yep, just reach out to us and we're happy to send those out.
And then I think there was one more question, right? Oh, it was actually, no, it was not a question, but thank you for reminding me about how I can incorporate developmental level specifics in my teaching plans. I think this will help not only the child, but mom to decrease anxiety. So that's good. And then I think I saw something else just come in just now. Oh, thank you. You're welcome. But wait, there's more. Oh, I think we're good. We have a couple more minutes left. If anybody has any more questions, I don't want to. Oh, I missed how much the cost of Navina is.
We actually didn't talk about that, but we'd be happy to share that information. So most insurances actually do cover transanal irrigation. Our experience with WellSpect is that about 75% of insurances cover transanal irrigation. But I can speak to WellSpect specifically about our cash pay program. So we do have that as an option for patients and people who don't have Navina, or I should say transanal irrigation coverage. So that's something that would be much easier to email you. So if you'd like to reach out to the WellSpect clinical team, we'd be happy to share that information with you.
Do you want to just tell me quickly again, maybe an email that I can put in the chat for people?
Yes, sure. Let's see here.
I think if you go up one slide, it was on our last WellSpect slide. Or back one more. So we do not specifically ship to Canada. There is a supplier in Canada for WellSpect products. It's called Red Leaf Medical, and they carry WellSpect products in Canada. Yeah, you're very welcome. We're glad you all could come.
And there was also another question. What about digital removal of stool in low-level spinal cord problems and no way to eliminate stool?
Digital removal. So digital removal may be needed in some cases if that stool is really hard. But typically, if they're using Navina, so Navina or transanal irrigation therapy is more of a maintenance therapy. So the goal is to get to the point where they use transanal irrigation. It empties the majority of that colon and keeps that stool soft. So there shouldn't typically be a need for digital removal with transanal irrigation as long as that stool is staying soft. You would never want to use force to push that rectal catheter or cone in, and if there's resistance resistance being met as you're inserting that catheter or cone, you'd want to stop and reevaluate things. But if there is hard stool there, or that water's not wanting to flow in, or the balloon's not inflating, that could be a sign that there's some harder stool there that may need digital removal.
And there's another question. So can we get Navina with red leaf? And I'm thinking that is in Canada. And do you have a
Yes.
letter prescription template for providers to sign for ease in helping families to submit to the insurance company?
I think Navina Classic is available with red leaf. I'm not sure about Navina Smart.
I'm not too sure about that either, but we can definitely look into that.
Yeah.
And then also too, I'm sorry.
I was just going to say for the letter, we do have a template for a letter of medical necessity. That's geared more towards United States insurance. So I'm not sure about the specific prescription needs for Canada. They may have different needs.
And if they were to send an email to the email on the screen, would someone then be able to direct them to how they could get that responded to in Canada?
Absolutely. Yep. Yep. You can email us there, or if you go to the website, wellspec.us, there's a contact us form as well, whichever is easier, or always call us too. That's fine.
I don't see any more questions or chats. Do you? I don't see any more.
I don't see any more questions either.
Okay. Well, I'm just going to go back here really quickly just to remind everybody about the next session coming up on September 19th. And again, thank you so much, Catherine. Thank you so much, Lisa, for your time, for all the wonderful information, and for for answering all those questions. We really appreciate it. And hopefully we'll see you again another time.
Sounds great.
Thank you.
Thanks so much.